I worked in pediatric gender medicine for nearly 5 years, and I was once a true believer. You currently have a loophole written into your law, and it is my belief that this loophole is as dangerous as having no safeguarding laws at all. There is no exceptional or severe case in terms of calling a child trans. Remember that this is a diagnosis that is not based on any scientific metrics. There are no lab tests, no brain scans, and no independent measures. What I know from my clinical experience is that the cases that will be sent through this loophole are going to be the children who have been lied to the longest. It is those who will be deemed severe. We saw children as young as 3 in my center being socially transitioned. When a child is socially transitioned at these young ages, the entire world around that child creates a falsehood. You can think of the movie The Truman Show. The entire world, the set, the stage, the production is to create for that child a false future where a transition is sold to them as being possibly successful. So yes, the response could be called severe when the constructed false reality around the child is taken away. That does not make this a diagnosable medical condition. In addition, the guidelines themselves do not recommend that these treatments are to be used when there is a real risk of suicide. One can actually not provide true informed consent when they are in the throes of suicidal ideation. The guidelines themselves have always stated that other mental health conditions, including suicidal ideations, should actually be well controlled. The psychologist who just first testified was incorrect about when a child or individual should be offered these interventions. These interventions are actually not and never been proved to be a treatment for suicidal ideations. This is a treatment protocol that is sold to children, and what it really is a philosophical issue. A philosophical cause does not make a puberty blocker or cross-sex hormone ever legitimate as an evidence-based intervention. The other cohort of children that this loophole is going to allow is going to be the older children who will see these rules as a wall to get over. The psychologist just talked about this. They will create the intense level of distress. These children are very smart, and they're often very socially challenged. If you tell them the way to get what they think that they want, they will become the most distressed. They will become the severe cases. They will create the outcome that your loophole has created. And parents will also do this. Again, there is no clinical test to prove that the true trans child exists. These parents will create to meet whatever rules you put into place. So if your loophole said that true trans children have to have blue hair and only 9 toes, I absolutely guarantee you, from working with this population for nearly 5 years, that many of these parents will show up with children with blue hair and 9 toes, even if it means that they will have to physically harm their own children. I am also continually surprised that anyone in the public thinks that gender doctors and therapists are operating in good faith. In my own center, one of the reasons I became a public whistleblower and lost my entire career is because I watched therapists and doctors bold-faced lie to legislators. The doctors I work with claim that we had nothing to do with surgery in minors after we had just seen surgical scars in minors in our clinical setting. Why do you think that the gender clinicians in West Virginia are any different? You have told them that you can still do this with 2 letters. Well, then 2 letters everyone shall have. You left a loophole so big that the gender doctors will drive a school bus full of kids right through it. Kids who will end up sterilized without sexual function and harmed. There is no number of kids that these procedures are safe or effective for. Not 20 kids with 2 letters and not even 1 child with 100 letters. I did this to children. I have this weight that I carry with me every day. I saw the hidden outcomes that they're not going to discuss. I saw the loss to follow-up rate of nearly 30% of this cohort. What I know and what I've done means that I will never agree that any child should be put through this ever. Thank you for your time.